If you find yourself often clearing your throat or feeling congested, it could be more than a simple cold. That's why it's important to stop by Mesa Rehab to see if they have a service to help you. This segment is sponsored by Mesa Rehab. Dr. Tammy and Chris, it is so nice to see both of you, and I'm really excited to learn about this term I recently heard, lung therapy. So what exactly is that?
Yes, in fact, I think it's really important to use simple terminology. Often patients find it very overwhelming when they hear all these complex medical terms. So therapy for your lungs is called pulmonary rehab. Just like physical therapy is for your body, pulmonary rehab is for your lungs. And if you think about it, what it is an opportunity for you to have a medical program where you have a therapist, different types of therapists work with you, and they're evaluating you from a physical therapy standpoint and a respiratory therapy standpoint.
Wonderful. Well, Dr. Tammy, what type of diagnoses would require lung therapy?
Oh, good question. So we treat a wide variety of lung diseases, the majority being COPD, which is chronic obstructive pulmonary disease, bronchiectasis, asthma. There's actually 9 different classifications of diseases within that umbrella of COPD. In addition to that, we also treat patients who have long COVID. And this, of course, has raised its head in the last couple years. There's certainly a lot of people out there still with long COVID, and when they present themselves to the physicians, it's primarily shortness of breath and chest pain. So we have a program to address that. We've been very successful in getting these people back to work, but it's still a chronic problem out there as far as long COVID. So a lot of different diseases, a lot of different impairments in the lungs that we treat, and a lot of people are, when they certainly just have shortness of breath, that's a time to ask the question, should I be evaluated? Should I be assessed on my lung capacity? Have I been a smoker in the past? Anybody who's had a smoking history of 20 years or more really should go in and get a scan. American Lung Association just did a wonderful campaign called Saved by the Scan, and we encourage people to get scanned if they have that kind of smoking history.
Well, when you think about all these people you're able to treat, I'm surprised this isn't a term that we're talking about all the time. It seems like so many people could benefit from this. So what's so special about the lung therapy that you provide? That's
a great point. So it's actually a very unique service. For instance, in San Diego, there's only 4 pulmonary rehabs, and we happen to be one of them. Our program is very comprehensive. So we look at that patient as a whole. Like I said earlier, they're working with different therapists. They're working with a physical therapist, they're working with a respiratory therapist, and we're evaluating that patient, and we're looking at lung volumes, which is basically how much air that patient's able to breathe in. We're looking at all these different deficits that would basically keep that patient from having their independence. And when they're working in these programs, we're also communicating with the doctors. It's this patient care-centered approach. For instance, if there's a significant change in the health status of a patient, we're reaching out to the doctor. Like if that patient had to go to the hospital, we're connecting all the dots there so that we're one big care team.
And Dr. Tammy listed so many things, and COPD is a big one. You work with a lot of patients that suffer from that. So how is that helpful?
It's very helpful. I mean, they say that there's 18 million Americans that have COPD, and there's probably even more that don't even realize they have a lung disease. Something that we've learned is that lung diseases are pretty much all progressive. So it starts out at one level, but it progressively gets worse. Often what happens is that patients put on oxygen, they're sent home with more medication, just to find out that 30 days later, they're sent back to the ER room. And what we do is we try to prevent that. We try to stop that in its tracks.
With all these prescriptions and appointments and oxygen, I bet people are in and out of the hospital. It's like a hamster wheel.
You're exactly right. In the medical world, we call this the revolving door. And honestly, it's a very sad thing. I mean, there's a 40% chance that if someone goes to the hospital, that they're going to come back. And this is a drain on both the hospital system and on patients' costs. And one of the most important things here is that this is something that is preventable. Most of your patients probably never even heard of therapy for your lungs, and that's why we really want to get the awareness out about that.
Okay, wonderful. Well, thank you both so much for your time and all you're doing for our community. This segment is sponsored by Mesa Rehab.